Chapter 1. A new weapon in the fight against cancer. What is CAR T-cell therapy? Cancer has long challenged our best medical minds. Traditional treatments like chemotherapy and radiation can come with harsh side effects. Now, CAR T-cell therapy offers new hope to patients battling certain types of cancer. This therapy harnesses the power of the body's own immune system, specifically T-cells, to target and destroy cancer cells. CAR T-cell therapy supercharges a patient's T-cells, turning them into effective cancer-killing machines. It involves taking T-cells, which are part of your white blood cells, from your blood and sending them to a lab. The lab adds a receptor that will target a protein in your cancer. This receptor helps the T-cells latch onto your cancer and destroy it. The journey to CAR T-cell therapy begins with leukapheresis, a safe procedure to extract T-cells from your blood. Your T-cells are separated and collected into a bag. The machine only takes your T-cells and returns the rest of the blood to your body. There are few side effects with leukapheresis. But these rare side effects may happen, which are temporary and manageable. The leukapheresis team closely monitors you throughout the procedure. One main side effect of leukapheresis is low calcium. The machine uses an anticoagulant solution to help prevent blood clots during the procedure. Unfortunately, this solution absorbs calcium from your blood. This may cause the calcium level of your blood to decrease. If you feel any muscle cramps, numbness, or tingling around your mouth, cheeks, forearms, fingertips, or toes, tell your nurse. They can assess you and add a calcium replacement into your blood through your catheter. We also suggest eating high-calcium foods such as ice cream or yogurt the day before your leukapheresis appointment. Blood pressure changes are rare, but they can happen from the leukapheresis process. This happens when your blood is moved from your body through the machine and back to you. Your nurse will watch your blood pressure very closely. Let your nurse know if you feel lightheaded, nauseous, or faint. These are signs of low blood pressure or hypotension. Remember, the blood filtered by leukapheresis is crucial for the success of CAR T-cell therapy. Chapter 3. Transforming T-cells in the lab. Once leukapheresis is done and your T-cells are collected, they are sent to a lab to make them into CAR T-cells. This process may take up to 2 to 8 weeks. After the CAR T-cells are made and sent to Stanford, you'll start chemotherapy or chemo. Chapter 4. The role of lymphodepleting chemotherapy. Before CAR T-cell infusion, you will undergo lymphodepleting chemotherapy or LD chemo. This step prepares your body to receive the CAR T-cells and enhances their effectiveness. LD chemo usually takes place in our infusion treatment area called the ITA. The purpose of this low-dose chemo is to weaken your immune system. Weakening your immune system gives the CAR T-cells room to grow and expand when they're infused into your body. This helps the CAR T-cells target and kill your cancer cells. Side effects from your LD chemo. You will likely have some nausea, vomiting, diarrhea, and fatigue from the chemo. These side effects shouldn't be severe. Remember to call your healthcare team with any concerning symptoms. To prepare your body for CAR T, you will receive IV chemo. The two most common chemo medicines are called cyclophosphamide and fludarabine and are given for 3 days. The chemo lowers your blood cell counts. You have 3 types of blood cells, each with a different job. White blood cells fight infection. Red blood cells bind to oxygen, and platelets clot blood. This means you may have a fever, fatigue, and bleeding. If you have any of these symptoms, let your care team know immediately. Your healthcare team will monitor you closely and provide supportive care. Chapter 5. CAR T-cell infusion. You'll have 2 days of rest between the LD chemo and your CAR T-cell infusion. The CAR T-cells will be infused through a central line. The cells are thawed before your infusion. When they are infused, you may have symptoms such as a funny taste in your mouth, dry cough, nausea, or flushing. These symptoms are from the preservative in the cells that protects them in the freezing and thawing process. We'll give you a mint candy to help with the taste. Patients rarely have shortness of breath or an allergic reaction. You will be closely monitored during your infusion. The cells take about 10 to 15 minutes to infuse. When the cells are in your body, they become a living therapy. CAR-T side effects. The CAR-T cells will grow and expand in your body as your new immune system to fight your cancer. You may experience several side effects from the CAR-T cells. These side effects are called cytokine release syndrome or CRS, neurological toxicities or ICANS, and prolonged pancytopenia or low blood counts. Remember to watch the other educational videos on CAR-T side effects. There may be side effects not covered in this video. Please review the educational forms given to you by your healthcare team and speak with your doctor to further discuss your treatment.